Okay, let's dive in. Picture this. Bob. He's 58, works in a factory, no health insurance.
Right.
And bam, he needs a coronary bypass. In the U.S., they tell him it's $150,000.
Wow. I mean, that's completely out of reach for so many people.
Exactly. His life savings wiped out, maybe huge debt too. It just feels impossible for him.
Yeah, and faced with that kind of situation, Bob did what a growing number of people are doing. He looked outside the usual channels.
And he stumbled upon something pretty interesting, these sun and surgery packages.
Yes, the marketing term.
This specific one was in India. It covered his flight, a week at some beach resort, and the bypass surgery. Total cost, $10,000.
$10,000 versus $150,000. It's a stark difference.
Absolutely. And just like that, Bob becomes part of this whole phenomenon we're calling medical tourism.
Which is basically, people crossing international borders specifically for healthcare.
Now, traveling for medicine isn't brand new, right? Historically, you might see folks from, say, developing countries trying to get to developed ones for specialized treatment.
Sure, pooling family resources, that kind of thing. But the big shift, the one we're really seeing accelerate now, is the direction of travel.
How so?
Well, it's increasingly people from developed countries like the U.S. or maybe Canada or the U.K., where wait times can be long traveling to developing nations.
And the pitch is often that phrase.
Yeah.
First world healthcare at third world prices.
That's the hook.
And that's really what we want to unpack today. We've been digging into the source material on this, going beyond just the glossy brochures.
Yeah, trying to get the full picture.
Our mission for this deep dive is to pull out the crucial insights. Who's actually doing this, why, what are the benefits they talk about, but also, importantly, what are the significant, sometimes hidden consequences? We really want you to walk away truly informed.
Exactly. Because it's complex, there are definite wins for individuals, like Bob, essentially, but there are also these broader systemic challenges involved.
Okay, so let's start with the basics. What's really driving people like Bob to look overseas? Is it just the money?
Cost is, well, it's undeniably the biggest factor, especially in places like the U.S. You mentioned the uninsured, something like 48 million people, or even the underinsured.
Yeah.
For them, that price gap, Bob's $150 versus $10, it's just massive. Plus, healthcare costs in many Western countries keep going up. It makes these overseas options look incredibly attractive.
But it can't only be about the cost, can it?
No, you're right. Access is another huge piece of the puzzle.
Access in what way?
Well, in countries with nationalized systems, you often hear about really long wait times for certain procedures, months, even years sometimes.
So people travel to skip the queue, basically.
That's part of it. But it's also about getting access to procedures that maybe aren't available or aren't approved or perhaps aren't even legal back home.
Like what sort of things are we talking about?
It could be experimental treatments, like maybe certain stem cell injections that aren't licensed yet, or things insurance typically won't cover. Cosmetic surgery is a big one.
Okay.
But the range is really broad now. Dental work is huge. Lots of plastic surgery, fertility treatments, surrogacy programs. It's really diversified.
So it runs the gamut from life-saving surgery for someone like Bob to elective things or just getting around those system delays.
Exactly. And it's become big business. You've got countries across Africa, Asia, Latin America actively branding themselves, trying to attract these medical tourists.
Okay, so from the patient's viewpoint, it makes a certain kind of sense. Find a solution you can afford or access. And the story usually sold is that this is great for the destination countries too, right? Brings in money, creates jobs.
Absolutely. That's the standard narrative.
Yeah.
That medical tourism drives economic development, creates skilled healthcare jobs, leads to new hospitals with fancy technology.
And ultimately lifts everyone's quality of life in that country.
Yep.
Sounds like a win-win.
It does on the surface. But when you start digging into the data, the source material we looked at suggests the reality is quite different.
Different how?
Well, it points towards some pretty significant unintended consequences, as they put it. It's not quite the straightforward, positive economic story.
Okay, so let's get into those unintended consequences. Where do they show up most clearly?
A major area is in what we call health disparities.
Can you just define that quickly? Health disparities.
Sure. The NIH, the National Institutes of Health, defines them as essentially differences in the rates of disease, death, and the general burden of health problems among specific groups of people. Basically, unequal health outcomes.
Got it. And how does Bob going to India for surgery connect to those disparities back in India?
Well, think about the surgeon who operated on Bob. The source mentioned he was highly skilled, fluent in English, maybe trained in the UK or US. He likely could have started his career, or did start his career, in the public system, serving local people. But the private sector, catering to medical tourists like Bob, offers much better pay and resources.
So the best doctors get pulled away from serving the general public.
That's the pattern. It's not just one doctor, it's a trend. Skilled professionals migrate from the often under-resourced public sector to the lucrative private medical tourism industry. We call this brain drain.
Okay.
And the consequence: you have fewer top doctors, nurses, technicians available in the public hospitals and clinics. That makes it incredibly hard for the country to manage widespread health issues, things like TB, AIDS, malaria, for its own population.
So while Bob gets his surgery, the system meant to handle every day, critical health needs for locals gets weaker.
That's a major indirect impact, yes. And it's not just staffing, there's a financial drain, too.
How does that work?
Often, these private hospitals catering to tourists receive government incentives, maybe tax breaks or cheap land subsidies.
Public money supporting private, tourist-focused healthcare.
Exactly. And that diverts resources. In a country like India, where, large parts of the population still lack basic healthcare, clean water, sanitation, family planning, diverting funds like that is particularly alarming.
So public resources prop up facilities for foreigners while basic local needs go unmet. Another way it fuels inequality.
Yes, brain drain and this financial drain are key indirect drivers of health disparities. But the source material also highlighted some more direct exploitative aspect.
Exploitation. Like what?
The example given was organ transplants. Let's say someone needs a kidney in the U.S., faces a multi-year wait list. They might find a broker overseas who can arrange a transplant much faster.
Sounds efficient for the patient again. But where does the organ come from?
And that's the really troubling part. Often the donors are extremely poor, maybe illiterate. They're promised a large sum of money for their kidney.
But they don't actually get it.
They typically receive only a tiny fraction of what was promised after the surgery. And worse, they can end up with serious health complications themselves from the donation with no follow-up care.
That's awful. Does the recipient know any of this?
Generally, no. The recipient, like our hypothetical kidney patient, usually has zero contact with the donor, no idea about the circumstances under which the organ was obtained, or what happens to the donor afterwards.
That lack of transparency just seems ripe for abuse.
It absolutely enables the exploitation of really vulnerable people. It's a stark example of how this industry can directly harm locals and widen those health gaps. Though it's important to say this kind of thing isn't only happening in developing countries.
So medical tourism can definitely worsen inequalities in the host country. But what about the risks for the tourist? People like Bob, often going out of desperation.
Well, a big issue is the lack of consistent international regulation. There's no single body overseeing all this. Meaning the brokers, the agencies selling these trips, they might market heavily those sun and surgery packages, but maybe not give the full picture on risks versus benefits.
So patients might not know what they're really getting into?
Especially if they're desperate. The source used the phrase, gambling with their life. It can be a huge gamble.
And what if something does go wrong? Say Bob gets an infection after a surgery in India.
That's a very real possibility, even in fancy-looking hospitals abroad. If complications arise, what's his recourse? Trying to sue for malpractice internationally is incredibly complex.
Who would you even hold accountable? The surgeon, the hospital, the agency back home.
Exactly. Malpractice laws, liability, who you can actually sue, and where it varies wildly from country to country. It's a legal minefield.
And then if he manages to get home, but he's still sick or needs follow-up.
That's another major problem. The cost of dealing with those post-operative complications often falls squarely back on the patient.
And if they can't afford that care back home either.
Then the burden might shift to local hospitals in their home country, or potentially if they're in the U.S. and eligible for certain programs, maybe even taxpayers end up footing some of the bill for the follow-up.
It really creates these complex ripple effects, doesn't it? Affecting the host country, the patient, and even the patient's home country system.
Absolutely. And thinking about the home country system, like the U.S. in Bob's case, there's another angle.
What's that?
Well, Bob is uninsured. He might normally rely on, say, public hospitals or community clinics for any care he could access. When he takes his $10,000 overseas for the bypass,
That money isn't going into the U.S. system he might have otherwise used.
right. And many hospitals, especially public ones, rely on revenue from profitable procedures to help subsidize care for lower-income patients or cover losses on other services. So when paying patients go abroad for major surgeries, it can potentially strain the finances of those safety net hospitals back home.
Wow. Okay, it's clearly a tangled web. No easy answers here. Did the source material offer any potential solutions?
It mentioned several proposed ideas, yes. But it was also quick to point out that each one comes with its own significant hurdles and drawbacks. There's no magic wand, no silver bullet.
So what were some of those ideas?
Okay, one was taxing the medical tourism procedures in the private hospitals in the destination country, and then channeling that tax revenue back into the public health system.
To try and offset the drain.
Exactly. But the source was pretty skeptical. It compared it to trickle-down Reaganomics, suggesting it's unlikely that money would actually make its way effectively to strengthen the public sector where it's needed most. History suggests that doesn't always work out.
Okay. Not very promising. What else?
Well, the idea of creating some kind of international governing body, to set standards, enforce regulations across borders.
That sounds sensible in theory,
But hugely difficult in practice. Who gets to decide the rules? On what basis? Getting global agreement on healthcare standards and then actually enforcing them, that's a monumental challenge.
fair enough. What about tackling the brain drain? Keeping doctors in the public system?
One suggestion is simply paying public sector healthcare workers more in those destination countries.
Makes sense.
But then the immediate question is, where does the money come from? Especially in already resource-strapped countries. And even if you could raise salaries, is it enough to compete long-term with the potential earnings and career opportunities in the booming private medical tourism sector? Maybe not.
So likely not a sustainable fix on its own. Any other approaches?
There was mention of using a quota system. South Korea was given as an example, apparently. They've allocated only 5% of hospital beds for medical tourists.
Limiting the scale to manage the impact?
Right, but that raises a really tricky ethical dilemma. What happens if demand exceeds that 5% quota? Do you turn away a patient, maybe someone in desperate need, just because they're a foreigner and the quota is full? It's ethically fraught.
Yeah, that's a tough one. It really highlights the deep complexities, doesn't it?
It absolutely does.
Do you see how it helps some individuals in, really tangible, good ways?
It provides a lifeline, truly. For people facing impossible costs or endless waits, it can be life-changing.
But at the same time, it has these really quite adverse effects on health systems, on equity, sometimes on the very people it's supposed to be helping economically.
And it's hard to assign blame neatly, isn't it? You can't really fault Bob for finding a way to get surgery he needs.
Right.
And you can't easily condemn a doctor for seeking a better livelihood in the private sector. Everyone's sort of caught within this larger system.
And yet, hovering over all this is the idea that healthcare should be a human right. The World Health Organization says so.
Exactly. And if we accept that premise, then the issue of healthcare equity, fairness in access and outcomes for everyone becomes a global responsibility.
So given how global and complex this all is, where do we even start? How do we begin to address it?
The source material was quite clear on this. The crucial first step is simply awareness.
Just knowing this is happening, understanding the dynamics.
Yes, raising awareness is absolutely essential before you can even hope to have the kind of global dialogue that's needed to tackle medical tourism's challenges.
Why is that global conversation so vital?
Because our world is just so interconnected now, more than ever. What happens in one country, the choices made by individuals or governments, can have really significant knock-on effects halfway across the globe.
We need to see those connections.
We do. We need to be aware of the wider impact of our actions and just understand the world around us better.
It feels like this whole area is still changing really fast.
It definitely is. The future is pretty uncertain. Things like the Affordable Care Act in the U.S. How much did that actually change the demand for overseas care? It's probably still playing out, influenced by lots of factors.
But one thing that seems clear is that people facing tough situations will keep innovating, finding ways around obstacles.
That's a key point. The rise of medical tourism itself shows incredible resourcefulness. Bob couldn't afford $150,000, but he found a creative solution surgery plus a vacation, basically, for a fraction of the cost.
Yeah.
Where there's a will, there's a way, as they say.
And that contrast really sums up the core tension we've been exploring in this deep dive, doesn't it?
It really does. Medical tourism acts as both an international problem and an international solution, often simultaneously. It demands a global perspective, a global approach to manage it properly.
But global change often starts small.
Right. It starts with local conversations, individual awareness, understanding the ripples.
And hopefully this deep dive has helped build some of that awareness for you listening. Just to recap, We've seen medical tourism offer genuine hope, real solutions for people crushed by healthcare costs or stuck on long waiting lists. A lifeline, like for Bob.
But as we've unpacked, it can also fuel serious systemic problems, widening health disparities, enabling exploitation in destination countries, maybe even straining resources back in the home countries. It's this intricate web balancing individual needs against these broader global consequences.
So thinking about that duality of medical tourism is this very personal fix, but also this complex global issue, it leaves us with a final thought for you. What responsibility, if any, do we have as individuals to understand the bigger picture, the wider implications of our healthcare choices, even when, perhaps especially when, we're facing difficult circumstances ourselves?